Welcome all of you. Today's topic of discussion is handling difficult conversations, especially when the patient is not understanding your point of view or is not cooperating. How do we really handle those situations? So there are various ways that we all handle. We'll first have a role play, just to have a feel how exactly we normally do it. So can you think of any situation that you handle or you have handled or you normally get to see or you feel that you have to handle but you feel I really do not know how to go about? Can you think of any situation while handling patients or their family members uh, where they are not agreeing with you?
Yeah, I it's
Dr. Sila, I'm not able to hear you. I think. Yeah. Anyone, can you think of?
all of us have faced that kind of situation,
Agreed.
especially when some unexpected complication happens.
Yeah, exactly. Exactly. So can we take any situation? I know, see, when you get seasoned, you learn how to handle that. You know what is the right way of handling such people. But problem is when we are beginning the career, at that time probably we haven't dealt many patients like this. And it really brings a lot of tension and anxiety and all sorts of thoughts in one's mind. How do I handle it? What will patients say? What will family say? What will my friends say? What will my colleagues say? Generally, there are a lot of concerns that we have. Of course, extreme difficult conversations like breaking bad news or disclosure of medical error, we will be discussing at length in the future session. But today's session, I thought that simple situation, like for example, you have put a multifocal lens to your patient, thinking that this will help. The patient is a teacher or a banker, and you think this patient will be really helped with the multifocal lens because they have to do desk work and also talk to clients, and you advise multifocal lens. And we know there are cases where patients are not satisfied. So there they come up with a lot of grudge that we paid so heavily for the lens, and on your recommendation, I got this lens, instilled, and now I am not, satisfied. So there it becomes very difficult to have hold conversation with that patient because you did everything to the best interest of a patient, but somehow it didn't work out well, or maybe the patient is not satisfied probably because didn't expect even these small problems. So can we take something like this? I can see Dr. Ashwini's message in the chat box. In glaucoma patients with advanced damage, reducing vision, possibility of blindness after surgery. Absolutely. I think this is one of the very difficult situations we all face. Uh, still in this, of course, explaining to the patient becomes very challenging because you have done your best. Patient has also done their best. But that's a kind of a disease where probably the damage once done is done. Uh, we can take this up also if you want. We can take this situation. But I want, or if you want to take this, or the one which I said, you have put in multifocal lens, but the result hasn't been, as you expected or as the patient wanted, or the patient is very kind of unhappy and is kind of arguing with you. So anybody who would like to take the task of the doctor who is handling this situation? Dr. Varsha, Dr. Ashwini, Dr. Atul, anybody? I know Dr. Sil, both of them are in at the airport, so I will not ask them to play the role of the doctor or the patient, but any one of you.
Ma'am, in such a situation, I think the pre-op counseling plays a lot of role.
Absolutely.
Because if the patient knows, already knows his or her conditions, so it becomes very easy for us to tell them about
Varsha, I assume that you did the pre-surgical counseling, but we all know that patient would have selective listening, selective forgetting, selective attention. Because when they are motivated to do something, sometimes they don't listen to the risks involved that we explain them. We also sometimes, fail to really emphasize it substantially for them to actually understand that this can be one of the possibilities. So they could be anything. But you explained, but in spite of that, patient is not happy with the result because patient spent a lot of money for the multifocal lens. Or even this case of glaucoma, if you want to take that case, I'm okay, like whichever case you want to take. Anybody who would be willing to take the challenge? Dr. Varsha, will you take the challenge of being the doctor? It's okay.
Yeah.
It's only for the purpose of learning. See, we all want to learn from, because role play, I know it's an artificial situation, but that's the safest way to learn how to handle difficult conversation. Because when we do it in reality with the patients, it sometimes actually, backfires and misfires. So I think it's a very safe place. We're all, we know each other and we know we are not judging anybody. We are just here to learn from each other. And in future, everybody will be playing, some or the other roles. So don't worry about that. So
Yeah,
who would
sure.
be willing to be the patient and the attendant? I want two more people. Uh, Dr. Varsha is the doctor who will be handling this case. So, but I want little aggressive patients or aggressive attendant, because normally when you have paid so much and you don't get good result, you're definitely very dissatisfied and you are annoyed and you use all sorts of ways to blame and to fight and argue and to prove that you have had an unfair, result.
Okay, I can be the patient, ma'am. I will be the patient.
Wonderful. Thank you, Dr. Atul.
Yeah.
Okay.
But what's the occasion? What was the scenario?
Scenario we can take that.
I can. One scenario is dealing with patients with infection, endophthalmitis, and after doing everything, we need to tell the patient that we have to eviscerate your eye. This is very difficult
So
situation.
this is this is a very important and relevant issue for the role play, but we can take this into when we take breaking bad news. We have this as one of the topics. So this is something very serious, and their breaking bad news is a very we'll be discussing that topic at length.
Okay, no.
We can take something lighter, something
Lighter.
something lighter. So like I suggested that you put in multifocal lens and the patient is not satisfied. Maybe
Okay, we
patient has
can take that
glare,
scenario.
you have glare, or you have difficulty moving your head up and down and you feel dizzy, like normally we get to hear from patients after
Yeah.
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 So maybe we can take that. I mean, Dr. Atul, you be the patient. Dr.
Yeah.
Ashwini, can I request you to be the patient's attendant, maybe patient's sister or family member, any family member, Dr. Ashwini?
Yes, ma'am.
Okay, so it has to be little aggressive because we want to see how to handle even that situation. That's the learning that we want to do. Okay. So what we will do, we will be leaving three of you on the main arena, and we all will be closing our videos, but we will be listening to what you are do. The idea is that how you normally handle you handle Dr. Varsha. There's nothing right or wrong. We want to just improve our skills. So don't think that we are judging or evaluating you. But those of us who are going to be observing, like Dr. Asim, Dr. Sabyasachi, and me, we will be observing you. The request that I'll make to observers is first observe three important areas. One is language part. Second is para-language part. And also body language. Very specific, these three areas. What all do you observe in what you think Varsha did well in the role play in terms of the language, para-language, and body language? So we have to keep the feedback positive because we want to find good things. So always approach the situation with a very positive mindset. The protocol is when we give feedback, it is 3:1. So that means 3 good points and then 1 point that, okay, this could have been done differently. So idea is not to find fault with what Varsha does, but the idea is to learn from what she does. So let's identify what she does good in terms of language, para-language, and body language. And then maybe when I ask you to give your feedback in terms of what could have Dr. Varsha done differently, then maybe you can give 1 point. And again, please no harsh thing. So we are here to learn from each other. And Dr. Varsha, take it easy. It's a learning activity. We are not here to
Okay, fine, ma'am. Yeah,
we are
fine.
no one to evaluate you. You're all best in your own capacities. So is
Yes.
this question clear, Dr. Varsha, or you want to ask some more questions to the patient before we
Yeah.
proceed?
Yeah.
Yeah. So should
So,
we?
ma'am, as per the scenario, the operation has been done.
Yeah.
Yeah. Okay. Okay. Fine.
Surgery is done. Patient has come for
Yeah.
post-op, and now patient is
Follow.
giving
Yeah.
his or her complaints that these are my complaints.
Okay. Okay. Fine.
So
Fine.
we keep the whole thing for say 2 minutes, 2
Yeah.
to 3 minutes, 2 to 3 minutes. Okay. So we are all switching off our video. I request others also to do it. Only 3 of you will be now visible to us.
Yes. Mr. Atul, how are you?
Madam, before surgery, you had told me that this is the best lens, but now it's been almost 1 month after surgery. I'm not able to see near things, and at night I'm not able to drive at all. I've spent so much money, madam. You said this is the best lens. We will take all good care of you. This is the best hospital. But then you see, I'm not able to see near things. I'm not able to see clearly everything. What's
Yes.
gone
Yes.
wrong? What is the wrong? What has gone wrong here?
Yes, Mr. Atul, please wait. What are your problem? Basic concern is what? Means you are not able to drive, or you have some glare problem or something like that?
At night time,
Can you explain me in short?
whenever I'm driving, I see a halo in front of the vehicle whenever the vehicle is coming. So then I have to close my eyes. I'm not able to see at all. I have to drive at very low speed, 10, 20. I cannot drive. I have stopped driving at night because of this issue. And even near vision, you said that I won't need glasses at all. But you see, this small on the medicine and everything, I'm not able to see that without glasses.
Yeah, yeah.
Madam, what we have
Yes,
observed, so we did
Yeah.
surgery for the same thing, and we are facing same issue post surgery also. So we have spent so
Okay.
money and we
We
have
have
not
spent
got
so
any
much money.
solution.
Yes.
Yeah,
He is not able to go
definitely.
in the light. He is not able
Yeah,
to
yes,
go
yes.
at evening in the light. He has to wear his glasses all the time. There is lot of difficulty in
I have photophobia,
light.
glare problem.
Okay, okay. Yes, yes.
We
Yeah,
we are not happy at all with the result.
yes, yes, ma'am. Yes, your
You
problem
said
is
this is the
really
best
genuine, sir.
hospital. This is the best possible
Yes, yes,
lens.
yes. Yes, sir. Yes, sir. Sir, this is your genuine problem. I agree. But I want to tell you one thing that just we had put a best lens in your eye, but it will require some type of adaptation for your eye and brain to get adapt for the newer lens. And since this is your first surgery, it will take some time. As the time will pass, you will definitely adapt to this situation. Okay, so we
And it's
will wait
already
for
1 month.
some time. Yeah. It's already 1 month, but as per the scientific study, it already takes around 3 to 4 months to adapt. And if you go for the another surgery again, it will increase your depth perception. So this problem might get eliminated with the surgery. So the surgery has been done at its best level, and the IOL we have put is also good quality. And there is no harm or there is no any problem with this such type of the IOL.
I'm afraid of
Okay,
going for another surgery.
yeah, sir. Yes, sir,
But no
yes, sir,
one
you are
told us,
correct.
ma'am,
But
ki it will take
yes,
so much
yes,
time because we were not expecting
And
ki it will
nobody
take so
explained
much
us
three,
about
4 months. No
yes,
one
nobody
yes, yes,
explained us
explained
about
us
this
this
glare
before
halo
us.
problem also. Nobody explained us
yes,
in
yes,
So
before
yes, you are
surgery.
correct.
You could have
so
told us
we
about
But
this glare problem. We could have avoided this multifocal lens.
they told us
yes,
that this
yes,
is the best lens, you go for it, and we chosen it. If they told us prior that there so many issues will be there, we would have gone for other lens. Why to spend
yeah.
so much of money then?
Ma'am, what the situation is, it differs from person to person. It also depends on the perceptual ability of the patient. So most of the time, in about 95 to 97% of the patient, we have good results, and that's why we have recommended this type of the lenses. And believe me, in 3 to 4 months, you can have a best vision and you will be happy. And sir, if the problem persists, we have the solution, other solutions also. So it is not like that we have nothing left with in our hand. So we can go for the other solutions also. So you
But
don't
what
worry.
I want
You
to tell
just
you
हाँ,
is, ma'am,
yes, yes,
but that
yes.
those 3-4 months he is paralyzed at home. And that day while evening he went for a walk and he almost had a fall. When he
Okay,
went
okay.
outside. So that
No,
again
ma'am.
we have to take him to the hospital. We have to treat him for that. So after the surgery, he has become handicapped. That
No,
is his
ma'am. See,
problem. So these were
correct.
so we are landed from one problem to the other problem. And you are
Uh,
again telling us now that we will have to be in this problem again next 3 to 4 months. So his life it is limited to the house only. He can't go bright in the bright sunlight. Evening he can't go out. So I mean it is very difficult for us to see him at home like this.
yeah. No, ma'am. If the situation is so grievous, see, we will wait for the 30 days or 1 month. We will see how the things are improving. And if we find that the things are not improving or it is remaining as the same, so we can go for the alternative at this level also. We can go for the IL exchange, and believe me, it will be not harmful for him at all. Okay, so we will go by one.
एक
It's
सर्जरी हो
not
गया
like
फिर
that,
अभी
ma'am.
दूसरा सर्जरी क्यों करें हम नहीं करना चाहते दूसरा सर्जरी.
Ma'am, see, every surgery has its pros and cons, ma'am. There is no thing in the life is without pros and cons, ma'am. So every surgery has its own advantages, has its own disadvantages, and we have to take the risk, ma'am. We have done at our best level, and still we are doing, ma'am. It's not like that. Some patients have such type of the problems, and they are his genuine problems. I'm not saying that he is lying to us, but we will see, ma'am. So we have to wait and we have to
We would
keep
like to
some.
go to consumer court for this. I think I can complain to the consumer court also for this against
Yeah,
you. Your
sir.
this thing.
So see, you can go for the consumer court, but it is not up to that level. We have not done anything wrong. It's a proven factor, sir. Some patients are not
We will
become
also give
adjust to
bad
it.
reviews about your hospital and about you because we are not at all happy with you.
See, sir, these are the scientifically proven matter, not only about you, but there are some patients, and we have done for them also, and it has given us a good results. So we will see. Let's watch and wait.
Okay. Okay, ma'am. I think it's enough.
So this was the fall. One of the multifocal patient, no female patient, she came with the same. I mean, issue. She was so distinctly. I had a fall post surgery, and I'm not at all happy with the lens. So I just had that in mind and put it in the
Enough of
conversation.
scolding to Varsha.
Ma'am, I'm just going to
could
talk.
imagine
Just stop,
ourselves
sir.
in the
बस
same
हो गया
position.
अभी अभी आप घर पे जाओ. इसके आगे
Dr.
मैंने कुछ.
Varsha, I think you held the fort very well. You were
Yes, she
actually,
hold. Yeah,
yeah,
she hold.
wonderful.
We
I
could
think very,
imagine being in that place, her place. It's
very
very
difficult.
difficult.
I think only when Dr. Atul brought in consumer court and also bad reviews, then
Yeah,
probably.
then probably she was.
Absolutely. Wonderful. Thank you so much, Dr. Varsha, for taking that challenge.
Well,
Thank you. So if I may ask, first of all to you, what do you think you did well? What did you think you did effectively? You think you did very well?
Ma'am, I'm calmly listening to the patient's complaints. Not only patient, but also his relatives' complaints.
Absolutely.
So I am taking him as in a positive way, and not only telling him that you are wrong and this type of the situation won't happen with this our lanes. So I'm taking it in a positive way. Yes, there are some studies that have shown that these multifocal lenses are not suitable for the patient. So it gives a positive feedback from the patient side.
So you were trying to be very calm and you had a wonderful tone of voice. Absolutely. Can I ask the patient and the family and others about their feedback? Dr. Varsha, is that okay?
Yeah. She was.
Yes,
she
ma'am.
was.
Surely.
She was very calm. She could answer all our queries.
Yes.
In the end, if someone like whatever she did, she explained, we could have gone back. Not we would have gone back happily. At least we will. We would not have been angry at the end of our conversation.
At least should have been little calmer than
What
what.
about? Yeah.
So anything specific that you feel that she did very well and you were very impressed with her?
Yeah, she told about that scientific studies and everything. So she had that everything in her armory. So she could say that this happens to some patients and it will take some time. That's what should be explained.
Wonderful. Thank you. So Dr. Ashwini, what is your feedback? What do you think she did well?
Yes, ma'am. Same thing that she was calm and she held her composure and she maintained and she could deliver the message.
Wonderful. Thank you. So I want others to share their feedback. What do you think Dr. Barsha did effectively? Dr. Asim, Dr. Sabyasachi, Dr. Snail joined a little late, but if you observe.
Dr. Varsha tried to explain the things scientifically, being very calm. That was the good thing. And she never lost her patience. That is the good thing.
I think that's very important.
So that was my.
Anything from the body language point of view that you think that facilitated calming down the patient and the family?
She was always very comforting body language. Yeah, that was always a comforting body language.
Agreed.
No arrogance, nothing.
No arrogance. Agreed. Thank you. Thank you.
Dr. Varsha had command on her subject. She knows in and out about multifocals. Even she went to the range of doing I will exchange. So if she has that confidence, then only of handling complications, then only she can speak in that way. So I felt she was a confident doctor from the talks. And
wonderful. Wonderful. Thank you. I think that's a very good observation. Dr. Sabyasachi, anything from your side that you observed that you think she did well in terms of her language?
The first thing I'll say is I will never want Dr. Atul or Dr. Ashwini as my patients. There are a few things I noticed which I really liked. The first thing is she listened. And I don't know if this was important or not, but whenever Dr. Atul or Dr. Ashwini were finishing their statements or were finishing conveying one idea, she was nodding, which actually showed that she was listening to them. That is one.
Wonderful.
And the second thing is, except for say 3 or 4 times, she always kept looking at the camera or to her patients. So that somehow conveyed more confidence than what she was saying. The content was always there, but I think they were the deal breakers.
Wonderful.
Deal makers, sorry.
Yeah. I think that's a very wonderful observation, Dr. Sabyasachi. I think you were very keenly observing her demeanor and other aspects of body language. I completely agree with you.
Can I share some real experience of mine regarding the consumer court?
Sir, after we finish this discussion, I would request you to definitely share this because that will be huge.
Okay.
Yeah, just let's complete the discussion. Yeah, so I completely agree. I observed Dr. Varsha, constantly looking at the camera. That means you are making eye contact with the patient and family. That's very important. When you don't make eye contact, there's a feeling that probably you have done something wrong and now you are guilty of it. That's very important. Second, she was very patiently listening and nodding. So when you're nodding, that shows that, okay, I'm understanding, I'm listening, I'm agreeing with what you are saying. So nodding actually encourages the person to talk further. A very good question that you asked, Dr. Varsha, was tell me about your problems. This is a very important dialogue that we have to, initiate, because the moment you say this, patient will come out with everything. A lot of it probably you don't have to do anything or you can't do anything, but just venting and being able to tell this to the doctor that I'm not able to walk, I'm not able to go out, I'm not able to drive, I have to drive at a speed of 10 to 20 is so comforting for the patient that I could tell all my problems to my doctor. And then when you empathize by saying, I understand, I can understand, these are very genuine problems, what you're saying. You are not faking, I understand that you are actually genuine. So how comforting it will be for the patient to know that my doctor believes me and is agreeing with my problem and is not saying that you are just exaggerating and you are just making, a big issue of small things. So these are very, I mean, it might appear very trivial thing, but to a patient it can be a huge, a kind of comforter for the patient. Then when you brought in as per studies, I think again that's a very good this thing, because then it makes it scientific. And when you said 95 to 97% patients are benefited, so that means we expected you also to have the same benefit, and that's why I recommended. I think you said also that. That was very nice. Your tone of voice was very comforting, very confident, very welcoming, very friendly. Uh, I think it was all in all a very good role play that you tried. And if you are really doing something like this every day in your OPD, I'm sure your patients will be really very happy with the way you handle those difficult situations. Thank you so much. So if I may ask you first of all, Dr. Varsha, anything, if you were given a chance to do this role play once again, anything you would like to do differently? Anything that you think you would have done like this, or would have added?
Ma'am, I think my patient selection was very wrong. He's quite a demanding patient.
Just yesterday I was.
His relatives are quite demanding. So
Again, Dr. Varsha, this is not demanding. I think we got to even understand. When we are offering something, patient takes it with a leap of faith that I will get the best results. Especially people equate health with money. If I'm spending 1 lakh rupee, I should get more vision than people who are spending 20,000 rupees. Is it wrong? Is it wrong? So when you buy a TV for 1 lakh rupee and buy a TV for 30,000, you expect better, experience with 1 lakh.
Definitely, ma'am. Definitely.
It's not demanding. I think we are not used to demanding patients. We are used to patients who don't demand anything, who just accept what we give. It's a shock for us because now they are asking value for money. That's probably we have to get used to. I would say this. So they are not demanding. And of course, let me tell you, let me, bring this here because you have brought this point. My daughter, who is a dentist and who is practicing in USA. So yesterday I was supposed to take a session for another, group. It was on aggressive patients, handling aggressive patients. We'll be discussing this also in one of the sessions, in the forthcoming session. So I was discussing with her and she told me, Mom, in our clinics, we do disc assessment for every patient. So I said, that's not, DISC is a personality test. It's a personality tool. She said, we do it for every patient. I said, it's practically impossible. It's such a huge OPD. How can you do? I said, do you do it formally in a very, structured format? She said, no. It's the first person who gets in contact with the patient when they ask questions and when they probably write the case details, they simultaneously start doing the DISC assessment. And somewhere in the notes, they mention what kind of personality this person is. I think we have to get on with that kind of, there you will know that this patient will have more questions. This patient will have more expectation. So you have to find him. Not that I will not offer this patient multifocal because this patient is demanding. I will rather be ready because this patient is going to ask me more questions. I have to be ready.
Yeah, correct. Yes.
So it's not a wrong choice. Of course, if you think that treatment was not appropriate, that option was not appropriate, then it can be wrong option. It can be wrong option.
Okay. Yeah,
Not,
correct.
Patients are right. Patients are not wrong. They're human beings like you and me. They're human beings.
Yes, definitely.
Dr. Atul and Dr. Ashwini, do you think anything Dr. Varsha could have done differently that would have helped you?
No, I think she did everything. Only at the last, as you said, when I said about that consumer court and bad reviews, she was slightly confused. She couldn't handle that situation.
Because we are not used to this kind of conversation. We are not used to.
Yeah. We are not used to that kind of conversation.
Wonderful. I think these are
before that, everything was fine. At the end, only I think
she was managing it very well. Absolutely. Dr. Sabyasachi and Dr. Sil, anything that you think Dr. Varsha could have done differently? Just one point, maybe not too many, because we don't want to overwhelm her.
Yeah, she could have taken in real situation, she could have taken the patient in a very cozy room and sit together in a comfortable position and then start talking.
Yeah, I think we need to have that kind of a setup where patients feel, that they are being heard in a very,
Yeah.
I agree. I think that's something that we can definitely consider. Dr. Sabyasachi, anything from your side that you think?
I don't think like anyone could have done better. She did everything.
Thank you. Thank you. Dr. Ashwini, anything from your side you think
No, ma'am. I mean,
you're
she
happy with her, the way you conduct it? Okay. Dr. Mrs. Seal, anything from your side you think Dr. Varsha could have done different?
And, in this sort of difficult situations, you can share your phone number with your patient and can allow them to call you whenever they want, and they need not stand in a queue for getting your appointment. It can be like a first come first serve, like you are giving them priority. This
Wonderful.
one thing we do in our hospital.
I think very good input. Some
and
privileges
in
can
and
come.
sometimes we even don't charge the registration fee for this sort of difficult cases.
Very good. Very good. I think offering some privileges will comfort the patient and they'll calm down. I think it's a very important input. Thank you so much, Dr. Seal. I think that was a wonderful input. Dr. Snail, anything that you think that Varsha could have done differently? Please unmute your device.
Yeah, sorry for the late joining, ma'am. Actually, I was busy in the OPD. I just finished my OPD and came back. So actually, I did not heard her discussion with Dr. Atul sir. So I'm not much aware about that. So I could not comment, ma'am.
No problem. No problem. Thank you so much. No problem. So I think two important things Dr. Atul brought in was bad reviews and consumer code. And also sometimes people say, मैं पुलिस बुला लूंगा, मैं अभी पुलिस बुलाऊंगा, मैं अभी मीडिया बुलाऊंगा यहाँ पे, मैं अभी मेरे फलाना एमएलए मेरा दोस्त है, मैं उसको अभी बुलाता हूँ, आप देखिए अभी आपको कैसे सिखाते हैं कि आप कैसे पेशेंट्स को मिसगाइड कर रहे हैं, ओवरचार्ज कर रहे हैं. These are couple of very difficult situations and usually where we lose ourselves because we don't know how to handle. So for example, if the patient says कि I'm going to complain to the consumer code, I mean, I could say, sir, I can't stop you from doing that. You're more than welcome to do it. But honestly, that's not going to help you in any way. I think I'm ready to help you. I'm ready to do whatever best can be done. And I will see whatever best results we can give you or work for. Going to consumer court is just going to add more agony to your suffering. But if you wish to do so, I will not stop you. It's your choice. It's your call. You can do so. I've done my job in a very, professional manner. So in case if I'm called in the court, I will present my documents and prove that I have done things in a very transparent manner. But I would still suggest you not to consider that. That's one thing. If somebody says, I'm going to give bad reviews to you, again, this is a very common threat people use against us. Again, you can say, I'm really sorry. I know I can't stop you from doing that. But giving bad reviews is not going to help you or anybody. If I was refusing you to give service, if I was refusing you to help, you could have gone and given it. But I'm doing my best to see what best can be done in your case. If you still want to do it, it's your choice. So don't get panic. Don't become defensive, but address it. मीडिया बुला लेंगे, आप बुलाना चाहते हैं बुला सकते हैं, मैं मना नहीं करूंगी, मैं रोक नहीं सकती आपको, आपकी चॉइस है. लेकिन मीडिया बुलाने से आपकी प्रॉब्लम सॉल्व होने वाली नहीं है. आपकी प्रॉब्लम मैं सॉल्व करूंगी, हम लोग मिलकर सॉल्व करेंगे. We need your cooperation to help you. So make it a kind of a team approach. There you will be able to help them see that how that is not going to help them and bring their attention to the main issue. That's the whole idea. Dr. Seal, you wanted to share an experience. You said that about consumer code, somebody.
In my 28 years career in ophthalmology, I faced consumer court twice. In one I lost, in one I won.
Okay.
So first give me the taste. First let me tell you the one I lost. It was both were the cases of injuries.
Okay.
And the patient, the first patient, was hijacked by a political party.
Mm.
So we lost communication directly with the patient.
Mm.
And ultimately, and everything was decided by the consumer court, where we could see there were a lot of political influence.
Mm.
But we did not have any bad relationship with the patient.
Mm.
Somebody in between interfered.
Mm.
And the one we own, there, the judgment that was given by a retired judge of High Court is a testimony of my life, and it is worth sharing with others. Where he said the doctor has personally visited the patient with his equipments at home.
Mm.
So I can't say that there is any evidence of negligence from the doctor's part. So that was such a nice language in favor of a doctor by a retired High Court judge. So these are the two practical experiences
It's
of
an
my life.
evidence of clear evidence of your personal care can make a lot of difference. Especially in
Yes,
cases
yes,
where the
that's
patient is about to lose eyesight or has a grievous, injury, or we know that prognosis is poor. Giving personal touch there makes hell lot of difference. I think it's a live example of what you have said. Thank you so much, Dr. Sale, for sharing this experience. It's a huge learning for all of us, I think. And we all can take away a message from your experience sharing, that if you just connect with the patient, you can make things very different for the patient. So as I said, I think earlier also, Dr. KPS Malik, I met him at AIMS Jammu. I had gone to do a program there. And he mentioned that, not Jammu, I'm sorry, AIMS Rishikesh. It was at AIMS Rishikesh. So he said that a lot of time after surgeries, the patient would lose eyesight, would not get back the vision. But still they will come back and thank me saying, Doctor, you tried your best to save my vision. I'm very grateful to you. So sometimes it's not the result, it is the efforts which bring you laurels. That's in our hand. Result is not in your hand. Efforts are in your hands. I think it's a huge learning. Thank you so much. Thank you. So taking it further from here.
Ma'am, I just want to ask one question. Offering privileges to such a patient can carry a wrong message to them that we are at a fault.
Okay, so
in this situation, we are not at all fault, because it is a proven matter that some patient cannot tolerate the multifocal eye. So offering any privileges in the form of financial term can carry a wrong message, can convey a wrong message.
You are not offering any compensation. Don't offer any compensation, because compensation will lead to bargaining, which is not advisable. No, then the patient can extort any amount of money from you. कि 2 लाख देते हो तो मैं आपकी जान छोड़ता हूँ, 5 लाख देते हो. No, extortion is not something that we encourage. But saying कि देखो आपको जो तकलीफ है मैं उसको कम करने की जो भी कोशिश कर सकती हूँ करूंगी. I assure you. आपको वेट ना करना पड़े, आप आए, मैं आपको जल्दी देख लूंगी, मैं ये सब कुछ कर सकती हूँ क्योंकि मेरे हाथ में है. And it's always, in totality, patient would see the picture. It's never in isolation one behavior. And when you have completely, convinced the patient, I've done everything in a very, as per the protocol manner. Evidence-based practice, I have followed that protocol. So I am not, अगर आप कंज्यूमर कोर्ट जाना चाहते हैं जा सकते हैं, रिव्यूज गलत देना चाहते हैं दे सकते हैं, लेकिन मैं फिर भी आपको जो बेस्ट सर्विस प्रोवाइड कर सकती हूँ वो जरूर करूंगी, बिकॉज आई वांट कि आपको जितना भी विजन रीगेन हो सकता है वो होना चाहिए. So I think that's overall your confidence that will display how you handle, and that comes with practice, and do as much practice as possible. That's the only way to learn. Practice is the only way to learn. Okay, so taking it further, I'm going to show you now 4 videos. These videos are homemade videos. I want you to observe these 4 videos and then, try to see what do you see in that video. So I'm going to show you the first video and try to see again the language, para-language, and the body language part in that video. Okay. Okay.
मैम मैं आलू हाँ जी मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं कहाँ दूसरा हॉस्पिटल जाने के लिए कह रहे हैं उनके जो रिश्तेदार है क्या कह रहे हैं मैं डिस्चार्ज करता हूँ दूसरा हॉस्पिटल जाएंगे वो जो उनका बेटा है हाँ जी जिसके साथ जो है ना वो कह रहे हैं एक बार आपसे बात करा दो बात कर लीजिए जाने दो क्या करना है कौन सी सफाई करेगा छोड़ो करो डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे आप अपना बिल क्लियर कर लेना ठीक है बना दो डिस्चार्ज स्लिप बनवा दो
So what did you observe in this video? What was the attitude of the doctor?
She was not very much concerned about what is happening. So she should have involved her in the situation. I mean, could have talked to the patient. What is the issue? But rather, she didn't wanted to get involved into it. Just left it to the front desks or the staff to handle it, which is in this situation can be very risky.
So very good observation, Dr. Ashwini. I think you observed it spot on that she was not interested in taking any action. She was just withdrawn. Any other point besides what Dr. Ashwini has mentioned? Sorry, I'm not able to hear anything. Could you please repeat? Yeah. I think there's some network issue, I think, for both of you, Dr. Mr. and Mrs. Jill. So Dr. Atul or Dr. Varsha, and extremely sorry, we are not able to hear you.
No, try to hold the situation.
Dr. Sil, we could not hear you, I think, because of the noise or a network issue. Yeah, please say again.
She tried to avoid the situation.
She was just avoiding.
Tried to avoid the situation.
Excellent. I think that's another good observation. She was just avoiding any confrontation. She didn't want to get into it. Absolutely. Okay. Any other observation by Dr. Sabyasachi, Dr. Atul, Dr. Snehal, Dr. Varsha? Similar. Okay. So we all handle situations in primarily 4 different ways. As you said very rightly, she was not ready to take action. She was just avoiding confrontation. So this style of communication is called passive communication, where we withdraw from the situation. I sent a questionnaire to all of you. How many of you have done it? All? Okay. So can I ask you to put your scores in the chat box with a comma in between? So write all 4 scores with a comma in between. I hope you noted your 4 scores. Dr. Sabyasachi? No, I could guess that from your expression. Okay. I have them with me, don't worry. But those who have done it, if you can put your scores in the chat box for all of us to see, that will be interesting. So we all, sometimes use this way of handling situation. There's nothing wrong. But if that's my primary way of handling, then it is not safe. And we are going to discuss that at length, so don't worry. Okay. So I can see 2 scores coming in. Dr. Atul and Dr. Snehal has put their scores. Okay. So this style of communication is called passive communication style. Let me show you the second video. And I want you to again observe and tell me what you observe in that video. Give me 1 second to take you to, okay. It's the same situation, but different way of handling.
मैम आ जाओ मैम बेड नंबर 7 पे पेशेंट जाने के लिए कह रहे हैं कहाँ जाना है दूसरा हॉस्पिटल जाने के लिए कह रहे हैं केवल डिस्चार्ज कर दीजिए दूसरा हॉस्पिटल जाना है कौन कह रहे हैं उनका बेटा साथ में वो जो हर टाइम उनके साथ रहता है वो है ही बदतमीज वो बिल्कुल बेकार आदमी है हर वक्त कुछ ना कुछ उसको नया ही सोचता है अब क्या कह रहा है वो डिस्चार्ज करके हम दूसरा हॉस्पिटल लेके जाएंगे नहीं तो वहां जाके क्या इनको बहुत बढ़िया कुछ वो मिल जाएगा क्या यहाँ पे इनको क्या तकलीफ है क्या कह रहे हैं यहाँ पे क्या दिक्कत है उसको कह रहे बस हमारे डिस्चार्ज कर दीजिए हम दूसरे हॉस्पिटल जाएंगे नहीं तो वहां पे क्या यहाँ पे इसको क्या दिक्कत आ रही है कुछ बता रहा है कि क्या क्या प्रॉब्लम है उसको नहीं ऐसा तो कुछ बताया नहीं कुछ बोला नहीं अरे ये शुरू से ही ऐसे ही बोल रहा है ये वहां तंग करने वाला बंदा है किसी काम का नहीं है भेजो ऐसे बंदे से क्या करना है हमने और लड़ाई करेगा देखिए देर ये यहाँ रहेगा तंग ही करेगा कभी मेरे पास आता है कभी कहते जी सिस्टर ऐसे कर रही है कभी कहते हैं जी सिस्टर वैसे कर रही है कभी कहते हैं जी पर्दे नहीं ठीक है यहाँ पे कभी कहते हैं जी एसी नहीं काम कर रहा आपका बार बार कंप्लेन ही करते हैं भेजो इसको डॉक्टर राकेश को बोलो इसकी वो बना दे बात कर लीजिए क्या बात करनी है बदतमीज आदमी है जाने जान छूटेगी कुछ बोलना मत उसको कह रहे हैं ठीक है आप बना के देंगे डॉक्टर राकेश को बोलो उसकी डिस्चार्ज स्लिप बना दे और बिल क्लियर कर देना अपने भेजो जाने दो ऐसे लोग जाए ना ही रहे तो अच्छा सारा दिन से खपाई करनी पड़ती है ठीक है तुम्हारा क्यों उतर गया जाओ 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 जाने दो
So what did you observe in this video?
Ma'am, doctor, she is a little rude to the patient, means about the patient, and not want to take any responsibility, means she don't want to listen about the problems of the patient and don't want to solve them. Rather than he's blaming the patient for the everything.
Thank you. I think that was a very good observation. What do others say?
The doctor here was too judgmental.
Absolutely. Agreed. Completely. I agree. Had a lot of negative notions
about the patient's relative.
Yeah. He's complaining, he's dominating, he's very demanding. So very, very good. What do others say? Any other observation than what Dr. Snehal and Dr. Atul has shared?
Trying to communicate own views through somebody else.
Absolutely. So not directly interacting with the patient, not wanting to interact with the patient, but talking ill at the back of the patient and blaming the patient for everything and just trying to shun away the responsibility. Excellent. Let's see the third video and observe again, please, what you see in her conduct with the patient. I think there's slight network issue, probably that's why it's not loading. Give me a second to reload it. Yeah.
मैम आंसू मैम बेड नंबर 7 के पेशेंट जाने के लिए कह रहे हैं क्यों डिस्चार्ज मांग रहे हैं तेरा मैं छुट्टी करता हम दूसरे हॉस्पिटल जाएंगे फिर क्या तकलीफ है उसको तो कह रहे छुट्टी करता हूं मैं दूसरे हॉस्पिटल जाऊंगी यार बहुत ही पागल आदमी है हालत पेशेंट की इतनी खराब है छुट्टी करो रास्ते में कुछ हो गया तो क्या करेंगे उसके साथ जो अटेंडेंट है वो कह रहे हैं कि हमारे 20 साल है उसका जो बेटा है जो उसके साथ हमेशा बैठता है बहुत ही बेकार आदमी है जब देखो इसको पहले तो इतने नखरे इतने हैं कभी एसी काम नहीं कर रहा कभी ये नहीं काम कर रहा अब छुट्टी कर दो छुट्टी कर दो आपकी बात कराओगे भेजो उसको जरा सही करो उसको भेजो जरा क्या तकलीफ है भाई क्या हुआ है मैम डिस्चार्ज कर दीजिए तुम्हें उनकी हालत पता है इस वक्त क्या है बहुत दूर पड़ता है आने जाने में दिक्कत होती है इसलिए आप डिस्चार्ज कर दीजिए नहीं तो हॉस्पिटल तुम्हारे घर के पास ले जाओ डिस्चार्ज कर दो उनकी हालत इतनी खराब है रास्ते में कुछ हो हवा आ गया ना इधर के रहोगे ना उधर के रहोगे ज्यादा दिमाग मत चलाओ अपना इलाज करवाना है तो शांति से करवाना चाहिए ऐसे नहीं कि इधर भागो उधर भागो इधर आने के लिए खर्चा लगता है और इधर आते भी बहुत ज्यादा भीड़ हो गया तो पैसे है नहीं हमारे पास तो पहले ही सरकारी में चले जाना था यहाँ आने की क्या जरूरत है फिर आधा अधूरा इलाज करके अब जहाँ जाओगे तो वो लोग तो कहेंगे ना कि ठीक से इलाज नहीं करा उन्होंने मेरा भी नाम खराब करोगे रास्ते में पेशेंट को कुछ हो गया और मुसीबत हो जाएगी आप डिस्चार्ज कर दीजिए भैया बहुत ही बेकार आदमी हो तुम डिस्चार्ज तो मैं कर दूंगी पर दोबारा मुड़ के मेरे पास बताना ये कोई तरीका नहीं है इलाज कराने का अपने पेशेंट का भी नुकसान करेगा और मेरा भी नुकसान करोगे साथ ही साथ में हमारा आदमी है सिस्टर इनकी डिस्चार्ज स्लिप बना दो और बिल क्लियर करो इनका तब भेजना इनको जाओ और दोबारा मुड़ के मत आना मेरे क्लिनिक में पता नहीं कहाँ से लोग आ जाते हैं
So what is your observation about this video?
Although the doctor tried to meet the patient, but was not ready to listen to him.
And what was her approach?
Very arrogant approach.
Very aggressive and rude.
So as I said, primarily there are 4 communication styles. The first one was about passive communication, where we don't take any responsibility. We just quietly take a backseat and let things happen the way they want. Second is we don't take responsibility, but we talk ill. That is passive aggressive style. This style that I showed you is called aggressive communication style, where we are normally rude, authoritative, intimidating, loud with people. We do this often knowingly or unknowingly. That's another way of handling. There's another way of handling the same situation, and let me show you the video and then have the discussion around it.
मैम आ जाओ इसमें मैम मैं अपना एप्लीकेशन जाने के लिए जाऊँ
कहाँ जाना चाह रहे हैं
दूसरा हॉस्पिटल
छुट्टी के लिए कह रहे हैं
हाँ जी
जो उसका बेटा जो साथ में वही होता है उसका भेजो उसको मैं एक बार इससे बात
भूपेंद्र नाम है ना आपका, आप उनके बेटे हैं जी, क्या हुआ इनका? डिस्चार्ज कर दीजिए। कहाँ ले जाना चाहती है? किसी दूसरे हॉस्पिटल में जाए जो अपने घर के पास में होगा, वहां से आने में बहुत दूर पड़ता है और जो पैसा है उतना है नहीं, में आने जाने में खर्चा बहुत हो जाता है। तो बेटा अगर आप कहोगे छुट्टी कर दो, मैं कर दूंगी, मुझे कोई दिक्कत नहीं। तो मैं आपको ये बताना चाहती हूँ कि इस वक्त उनकी हालत जो है वो लेके जाने वाली नहीं है, क्योंकि एक तो जैसे यहाँ से अगर आप लेके जाओगे तो रास्ते में एम्बुलेंस को लेके जाओगे, कैसे होगा कुछ नहीं कर सकते, क्या सिचुएशन में कुछ नहीं कर सकते, मतलब हालत इतनी अच्छी नहीं है। थोड़ी भी ठीक होती है तो मैं कहती चलो ले जाओ, कोई बात नहीं। तो एक तो सबसे बड़ी बात ये है। दूसरा ये देखो बेटा, जैसे पिछले हफ्ते से हम लोग इलाज कर रहे हैं, तो काफी हद तक उनके बारे में पता है क्या उनकी कंडीशन है। अब नए हॉस्पिटल जाओगे, नए सिरे से वो इलाज करेंगे, मैं बेशक तुम्हें पर्ची बना के दूंगी, उनका सारा डिस्चार्ज लिख के दूंगी, जो जो ट्रीटमेंट कर दो। तो फिर भी एक होता है, डॉक्टर जो ट्रीट कर रहे होते हैं उनको पता होता है कि इस वक्त इनकी किस दवाई से इनको फायदा हो रहा है, क्या इनको नहीं सूट कर रहा। नई जगह जाओगे तो वो नए तरीके से सारा हैंडल करेंगे। तो देखो एडवाइजेबल तो नहीं होता बार बार डॉक्टर चेंज करना, और मुझे ऐसा भी लग रहा है कि पिछले 2-3 दिनों में थोड़ी, अगर आपने नोट करा तो उनकी कंडीशन में इम्प्रूवमेंट भी हुई है ना। इम्प्रूवमेंट तो हुई, बट उनकी पैसे वाली प्रॉब्लम आ जाती है। तो ऐसा देखो बच्चे, ये तो मैं मानती हूँ कि प्राइवेट में तो खर्चा आता है, अगर जहाँ भी लेके जाओगे वहां भी खर्चा तो आएगा ही आएगा, ऐसा तो है नहीं कोई फ्री में हो जाएगा। अच्छा सरकारी में अगर जाओगे तो वहां पे आपको पता है वहां पे इतना पेशेंट होता है कि आपके पेशेंट को बेड मिलेगा नहीं मिलेगा कुछ गारंटी नहीं है ना। देखो मेरे से पूछोगे अगर तो 2-3 दिन की बात और है, जहाँ इतना सह लिया ये भी आप कर, बहुत मुश्किल है। लेके जाना चाहते हो तो बेटा मैं सिर्फ तो नहीं कर सकती तुम्हारे साथ में, तुम्हारा पेशेंट है, तुम्हारी फादर है, तुम्हें डिसाइड करना है कि क्या करना, जो भी करना चाहो तुम कर सकते हो। पर मैं कहूंगी ये कि घर पे एक बार सलाह कर लो, अपने बाकी जो लोग हैं उनसे बैठ के सलाह कर लो, क्योंकि मेरा कहना ये कि 2-3 दिन की बात और है, जहाँ हफ्ता निकल गया तो 2-3 दिन की बात है। फिर भी कहोगे तो मैं कर दूंगी छुट्टी, मुझे कोई दिक्कत नहीं, मैं पर्ची बना दूंगी, पता कर लो जहाँ बेड है, इतना खर्चा कम आता है, जाने ले जाओ। वैसे आपने सही कहा, वैसे एक बार जाके घर में मैं डिस्कस कर लेता हूँ मैम, और पता करता हूँ कि 2-3 दिन की और बात है, और इम्प्रूवमेंट भी अच्छा हो रहा है उनका, तो शायद हो सकता है कि खर्चा थोड़ा एडजस्ट कर लेंगे तो हो सकता है सही हो। देखो बेटा हॉस्पिटल में खर्चा तो होता ही है, ये तो है नहीं फ्री कहीं काम होगा। वहाँ सरकारी में जाओगे तो वहाँ टाइम ज्यादा लगेगा या बेड नहीं मिलेगा, प्राइवेट में जाओगे तो 19-20 का फर्क आएगा, ऐसा नहीं क्योंकि जमीन आसमान का। फिर भी आप सलाह कर लो, मुझे बता दें, ठीक है। थैंक यू। अच्छा
So what did you observe in this video?
Yeah, doctor tried to address the issues faced by the patient and tried to correct his perception and make him a party in the treatment process.
Thank you. I think that's a very, very fine observation that you have given. Thank you so much. What about others? What do others say? Dr. Varsha, Dr. Sabyasachi, Dr. Atul, Dr.
Ma'am, doctor did not insist patient to stay, but she make the point that if you want to go, these are the risk factor. If you want to stay, is a better way for you. Means it's a better option for you. But she did not insist. So
that's very important. When we practice informed decision making, shared decision making, I think we have to remember we don't have to decide on patient's behalf. Otherwise, they blame us for the decision. Even if you think this is the best option, you can just say both the things and give your opinion that if you ask me, I'll suggest you this, but I want you to take a call. When you give them that option, they'll automatically take the decision in your favor, but then they will not blame you for insisting. That's very. Any other observation about the tone of voice, body language, and the language part?
Yeah, tone of voice was very good, ma'am. She listens to the patient very calmly.
Still, can you please mute your device? Dr. Sil, could you please? Yeah. Actually, there's a lot of noise from the airport, the announcement noise. Yeah. Thank you.
Yes, ma'am. Her tone of voice was very good. She listens to the patient very calmly and she thinks from the patient's point of view, ma'am. She explained to the patient all the.
I'm not able to hear Dr. Varsha. Are you able to hear all others? I think there is some network issue at your end.
Yeah, ma'am. Yes, ma'am.
Yeah, maybe if you switch off your
Can
video.
you hear me, ma'am?
Yeah, if you switch off your video, then your audio quality will improve. For a second, when you're answering. Yeah.
Yeah.
Go ahead, please.
Now, can you hear me, ma'am?
Yes, we can hear you. Yeah. So I think overall, you all felt that her body language was very professional and friendly. I'm not saying when you become friendly, you become unprofessional. You stay professional, but it's reaching out to the patient party. Tone of voice, if you observe, it was not rude. It was not authoritative. It was more welcoming, more friendly, but professional. Nowhere she used any slang language or any informal, making it more. No, that's not the idea. And approach was that she was empathetic. She was trying to look at things from the patient point of view and not judging. Why can't you do this much? आप अपने पापा के लिए इतना भी नहीं कर सकते, उन्होंने आपको पाल पोस कर बड़ा किया है, आप उनके लिए इतना भी खर्च नहीं कर सकते हैं. So not all that. But simply saying, see, we understand that, I mean, it involves expenses, but then we have no choice. So this is how you can actually deal with the situation. And this is called assertive communication. Now, if you look at the scores that we have, I'll just share the screen with you all to understand the scores that we have. You will be happy to know about your scores, and then give me a second to bring your scores to the surface. Yeah. There we go. So I have 6 people who have done their questionnaire, and these are the scores that we have. So your first column is your passive communication style score. Second column is your passive aggressive communication style score. Third column is your aggressive communication style score. And fourth column is your assertive communication style score. So for almost all of you, you'll be very happy to know that your assertive communication style score is very, very good, very high, which I agree. But this slight twist in this. The twist is your highest score is your primary way of handling situation. But your second highest score is the score that comes into action in a difficult situation. So primarily, you will try, for example, if I take whose example? Okay, let's take Dr. Atul's example. So Dr. Atul, you will use assertive communication in almost all situations because it's almost perfect 20. 19 is like perfect 20. But your second highest is your aggressive communication style. In case in a situation when assertion will not work, you are likely to move on to aggressive style. I don't know if you agree with that or not. Similarly, if I take Dr. Sil's example, Dr. Sil's highest score, Subra Sil, her highest score is 17, which is passive communication. So that's probably your dominant way of handling situations. On the other side, you are likely to move on to either passive aggressive or assertive communication in case if your passive style does not work. I can take one more example, rather 2 examples I would like to take. Dr. Ashwini, so you will try assertion, and if that does not work for you, you are likely to become passive and you take a withdrawn position. Dr. Sabyasachi, your highest score is on passive aggressive and aggressive. So I'm not sure if you have taken the test correctly or there is some confusion about it, but by looking at your scores, I can say that your dominant style of handling situation is either passive aggressive or aggressive. And in case that does not work, you can also use passive communication. You withdraw, but you are less likely to use assertive communication. I would suggest you to take this questionnaire once again to make sure that are these scores really true for you. Okay, anybody else's score? Okay, Dr. Asim Sil. So as Asim Sil, as your scores are highest on assertive communication, and again, it's perfect 20. So that means in most of these situations, you are able to, assert and put your opinion in a straightforward manner. But if that does not work, you're either likely to become aggressive or you may withdraw from the situation. Passive. But you are less likely to be passive aggressive. So passive aggressive, we carry the grudge with us. We carry that, unhappiness with us. You would not do that. You would either say or you will withdraw, but you will not carry that grudge. Even Dr. Snehal, you don't carry grudge with you as per your score. So you will either assert, if it doesn't work, you can become aggressive, but you are less likely to carry that grudge with you. Even in Dr. Ashwini's case, you are using assertion primarily. If that does not work, you will withdraw from the situation, but you will not be either aggressive or you will not be even passive aggressive. Do you all agree with your scores? That's my question. Do you all agree with your scores? Any doubts, any questions about these scores?
Now I know the explanation.
Yes, yes.
I agree.
I also agree. I got to know the explanation now.
And once I will share a presentation with you, very short presentation I have prepared for all of you, just to explain you these styles, what are the advantages and disadvantages. You will be able to work on yourself to modify your way of handling situations. That's going to help you. Any doubts about it? Any questions? Any disagreements? And I had mentioned that it's an eye-opening questionnaire. It will actually let you know about yourself, and then it gives you an opportunity to work and improve yourself. We all can work on ourselves. If we know our shortcomings, we can work on them and make things better. So if we have no more questions, I want to quickly move to the presentation on assertive communication. And then we have two presentations, one by Dr. Varsha and Dr. Ashwini. I think Dr. Ashwini wanted to present first. That's okay. So I just share the screen quickly and share the presentation with you all so that we can quickly move on to the discussion. Okay. So this is more or less what we have discussed, but you will get a deeper understanding of all communication styles. So as I said, we all use 4 different ways of handling situation. A very common way that you will see people using is passive communication. So passive communication is where people normally, they allow others to violate their rights. They actually respect others' rights more than them. They value others' rights more than them. And then they fail to express their own feeling. As a result, they kind of, just the purpose in the whole effort is to avoid any kind of conflict. So you just to avoid conflict, you don't take any stand and you don't openly, honestly share your experience. As a result, you will actually differ with others' opinion. You will avoid eye contact. You will use usually low and quiet tone, especially when you are discussing in a larger group. You will not actually give your opinion in an honest and open manner. There's very little risk involved because you're not saying anything, so you are not in favor or against anybody. So it's safe, but at the same time, it is, unsafe. And we'll talk how it is. Some of the examples of passive communication are very often will say, I don't know. If you ask them, they'll say, I don't know. Or they'll say, jo aapko theek lagta hai, kar lijiye. Whatever you think, please go ahead. Or you have more experience, please you decide. I'll go by whatever the group says. I have no opinion. So they will not share their opinion. They may even think in their heart, I don't care and it doesn't matter to me. So why the hell should I pay attention to it? They'll never ask for help willingly or openly because they'll be hesitant and they'll think, no, I can't ask for help. And they will also not be able to say no. If they're asked for something, they'll always say, I'll do it. Because they'll not be even able to say no if they think they cannot, do it. Now, if I may ask you, what is the disadvantage of using this style? What is the disadvantage of passive communication? What will happen if we are, see, once in a while, everybody uses. But if that's my regular way of handling situation, What is the disadvantage?
People may take many things for granted.
Absolutely, absolutely, absolutely. Very right. People will not take you seriously. People will not respect you. People will not value your opinion. What else? You will have no say. You'll be taken for granted. Does that happen when we use passive communication?
A very sorry state of affairs. You will yourself be chronically dissatisfied.
Absolutely, because you are not playing any active role, any major role in the situation. So you'll always feel I'm not worth anything. I'm not contributing. I'm not. So professional satisfaction, self-satisfaction will be completely amiss. So when is passivity appropriate? In certain situations, passivity is appropriate. Can you think of any situation when it is okay to be passive? Can you think of?
When there is too much of disagreement between among the workers, and for a limited period of time, it is better to remain passive.
I think I agree with you.
Not for a long time.
Not for very long. At least in this situation, you can take a passive stand because my saying is not going to help in any way. So it's always good to be quiet. Not just being quiet forever, but for that time being. I agree with you. Any other situation that others think that it's okay to be passive? Situations where the issues are minor. You can pick your battles. You can choose to be quiet. You don't have to speak and give your opinion for everything. When the result of pushing causes more problems than benefits. Again, if I push this is going to trigger a chain of problems. So it's okay to be quiet in this situation. There's nothing wrong in being passive in that. When the power differential is not in your favor, if you are in disagreement with the person in very high authority, and the person is just not going to understand your point of view, how much ever you might try, the person will not take your opinion seriously. So it's all right to be passive in that situation. Also, when the other's position is impossible to change. For example, when you're dealing with the person with law, again, probably how much ever you say, if the person has a point of view, you will not be able to prove anything. So again, in some situation, it's all right, but that should never be our primary way of handling situation because it is disadvantageous. Work will not happen. You will not be able to have good team working with you. Even if you're a team leader or a team member, things will not move further. Another way of handling situation is called passive aggressive style. Now, passive aggressive style is where you actually forfeit your rights initially, willfully, which is followed by manipulation and vengeance. So that means you will not exercise your rights, Pele, and then later on you will say, I was not asked. The goal of this conflict is also to avoid conflict, but making the other person feel that you were not given a chance to speak or you were not, taken seriously. So mostly people who use this style, they will behave passively in the, in the group setting or in general, but later on they would talk, ill about the person or the project or the activity. They will often use sarcasm in their way of communicating. Some of the examples of passive communication is they'll say that, yes, sir, I'll do it. I will be happy to do this for you. But when you ask them, have you done it? They'll say, sorry, I forgot. Or they may even pass a comment like, oh, you're so good at it. I think you should be doing it. Also, sarcastically, they may say, oh, great idea. You're really good at it. Or they may change the subject when you ask them to do something. So they just want to avoid the conflict, not take the responsibility, but make the other person feel responsible for not taking the responsibility. Now, what is the disadvantage of using this style? What is
You might lose trust.
I'm sure you'll have people in your system who are in habit of doing, backbiting, going and talking in your absence. Would you be comfortable sharing your thoughts and feelings with them? No. So the disadvantage is, again, people will not be comfortable with you. You will not have very many people willing to work with you or happy with your way of working. What other disadvantage do we have? Will work happen? Definitely not. Another style of handling disagreement is active aggression, where people use, aggressive way of communicating. They may speak loudly, they may shout at people, intimidate, especially people in higher positions. A lot of time they use aggression as a way of communicating. They think authority brings or gives them the right to be aggressive. So especially with their juniors, with their subordinates, with their people working, below them in the system, they take this as a way of interacting with them. So you will see them often, dominating the discussion, and they will not let others share their thoughts or feelings. Actually, they will not even respect others' thoughts and feelings. So the idea is they want to, win at all cost. So they are going to be very aggressive in proving that they are right. They'll protect their rights at the expense of others' rights. And then they'll be reckless in their approach when they don't consider the consequences of an action. So they may shout at their employee, the employee might resign and go, and then they have nobody to work for, but then they don't realize that it's my mistake or my fault of ill-treating my subordinate and not having an employee. Even at home, sometimes you'll see your maids and servants will often leave you and go just because sometimes when we are rude and misbehave with them. Of course, now I know we don't do that. We know that they're a very important part of our life and we have to keep them happy. But those of us who do this regret later because then we'll not have any support system available to us. And then they are reckless in their approach. And their eye contact, you'll see, will be usually angry and intimidating. They'll be actually looking at the person, staring at the person with a lot of anger and aggression, which will be very intimidating. They'll never defer to others. They'll always try to control the situation and prove that they are right and their opinion is more, valid than others' opinion. They use a lot of energy. You'll find them, using, speaking at a very loud voice, shouting at their staff. Sometimes they even belittle others by using foul way of embarrassing people and humiliating. They often use verbal abuse and violence in their approach. So, of course, we see this, not all, but a lot of people in authority we have seen were very, very aggressive with their employees and with their even help at home. They're very, very aggressive. So some of the examples of aggressive communication that you'll see them saying, what do you know about this place? So they're kind of refuting your opinion. Or they may say, can't you see that this will not work? So embarrassing and humiliating the other person. I don't care what you feel. I'm not going to, get affected by what you are feeling or thinking. Just do what I say. That means using authority and control. And then, of course, I don't know why you can't see this is the best way to do it. That means my way is the right way. So again, people who use active aggression, what is the disadvantage if you're using this in your workplace or even at home? What is the disadvantage?
You don't get the best thing out of your colleagues, and your acceptance among the colleagues goes low, and you are often misunderstood.
Absolutely. Will people enjoy working with person who is very aggressive? Because you are temperamental, you are unpredictable. People will fear you actually. Those who are working with you will never come out with their open and honest opinion, because they're too intimidated by your approach. So people who use aggressive communication, they need to actually, consider that attack or name calling or accusation will actually shut down their, communication with people or their relationship with people. And also, when you are tempted to attack, please remember that you are going to lose the relationship as well in that bargain. So before you actually react, it's important to give yourself a minute. Think, how would you like to handle the situation? Maybe the other person has gone really wrong, but there's so many other ways to deal with that situation rather than immediately, becoming aggressive and all that. So best way is take a deep breath, think, how else can I handle this situation? That will give you more ideas, that will make you calm. And usually when you speak in a calm tone, your tone of voice will change, your selection of words will change, you'll be less aggressive but more communicative. So aggressive people actually need to learn how to compromise and create space for others. In certain situations, you will see aggression is actually overlooked. Can you think of some situations where we overlook aggression and we are okay with it? Okay, it's all right. Do we allow that? Are we okay with some, in some situations when the other person is aggressive?
When the communication is between the two different levels, so sometimes we get a feeling of winning over someone else who, by virtue of the post or the rank, they are junior to us, and they will, whatever we say, they will listen, and we will feel that we have won the game.
Again, in
so that time we overlook our aggression.
Yeah, but even in that case, aggression is not the right approach, because that person might do something under pressure in that situation, but given a chance, that person will sabotage your work. It's not a long-term solution. Assertion is the right way of handling a situation where you are able to put your point across in a very firm way without being rude and intimidating. But I agree, in certain situations, people overlook our aggression, especially in a situation like crisis. So it's a crisis situation and you become aggressive, people say it's okay. It's a tough situation. So, I mean, anybody would lose control. Or when there is no time for discussion and explanation, there, if you're just commanding and ordering and asking people to do it, people will just listen and follow your instructions because they believe the situation is such that there is no time to, use discussion and explanation for a certain scale. And some situations where you are the only one who can save the situation. So people know that you are the person who can help us. So they will take your anger and your aggression with a pinch of salt. But in long-term relationship, in healthy relationship, aggression doesn't bring the desired result, because ultimately it's not something that people are okay with. People don't like to receive aggressive reaction. So if you look at these three styles of communication, see, people who are passive communicator, they'll actually be, forfeiting their rights and not taking any initiative or taking any responsibility. So very often you will see them, coming chronically late for work or also for the meetings. If you call them or give them a task, they will normally not report to you on time. They'll never come back with any questions. They'll not come back with any, task on time. Usually they'll have, inadequate work done or not done to the optimum level. They'll also even avoid meetings and, discussions, because they don't want to play any role. Usually they'll be silent participants in the meetings and even get-togethers. And they're usually ill-prepared for the program because they have not taken any initiative. On the other side, people who are aggressive, you will see them using a lot of inappropriate anger. Even that, if it's not required, they will be still yelling at people and degrading people. They'll be intimidating their staff, their patients, their colleagues, even family members at home. They can even go to the extent of, pushing people or banging door, throwing objects, throwing patients' file. In OT, you will see them throwing instruments. They're all signs of aggression. So they're outbursts of anger and physical abuse. It's very common among aggressive people. People who are passive aggressive, they are less likely to use aggression in an open manner, but then their approach is somewhat like, using aggression as a cover up. So you will see they will not hesitate writing hostile notes or emails or passing sarcastic comments or derogatory comment about people or about institutions. They don't even sometimes hesitate using inappropriate way of joking or embarrassing people, and also complaining or blaming about the system and others. So again, all these three ways are not healthy, not helpful, not productive. The way to handle any situation is to go about and use assertive communication. By the way, if I may ask you, what exactly we mean by assertive communication? Can somebody explain to me? What exactly we mean by assertive communication? Since we have had so much discussion around it. We normally think assertion is when we are adamant on a point, or when we are, rigid about a point. Honestly, assertion is not being adamant. Assertion is not being, sticking to one point and just my way is the highway or the highway. That's not the thing. In assertion, you actually put across your opinion in an honest and open manner. If you don't agree, you honestly say, I don't agree. But when you say this, you are not saying that I don't agree and I'm right and you are wrong. What they are trying to say, I'm not able to see your point of view. Can you explain me further? So in their approach, they're open, they're honest, they are positive and respectful. At the same time, they are confident that what they're communicating is their honest feeling. So people who use assertion, they actually not only look after their needs, but they also look after others' needs. So they protect their rights without violating the rights of others. If they're not understanding your point of view, they'll not say, your point is not making any sense to me. They'll say, I'm really sorry. I'm sure what you have to say has some meaning, but I'm not able to get that meaning. Can you explain me further? So they are open to listening. They are open to discussion. They are open to even change their point of view if they see a valid point in what you are saying. So they will protect their rights and they'll respect others' rights also. The goal of the assertive person is actually to put across their point of view in a respectful manner and also others' point of view. Listen to others' point of view. And then the whole purpose is to find a solution to the problem and create a win-win situation for both the parties. So not that I win and you lose. It's like, okay, I'm open to discussion. Let's see what can be done. For example, if a subordinate of yours says that I want to take leave tomorrow, I have an urgent work, and you have an urgent important work in your office, and you say, no, tomorrow is OT and there are so many cases, it's just impossible for me to give you leave. I cannot allow you to take leave. Now what happens? The person is in dire need of that leave. Maybe somebody is unwell or there's some death in the family or something, and you have a equally important and urgent work. You have an OT lined up and your case is lined up. So rather than just saying, I don't know, I cannot let you go, you have to come tomorrow, I don't care what you have at home. If you say, I understand you have an urgent task or urgent work, but this is also very important. Let's see what can we do to see if somebody else can take your place, or if you can come for these many hours, or if you can come and go a little early. So that means now you are trying to find a solution which creates win-win situation for you and for the other person also. So you will see assertive communication will always put their wishes very clearly and respectfully. They will share their opinion, but in a very respectful and clear manner. They'll be confident and strong, but still flexible, not being rigid about their point of view. They are objective and they do not easily get overwhelmed. So they will not get upset. No, tomorrow is OT. You cannot take leave. Whatever happens, you have to come. I don't care. Tell your husband to go, but you have to be on duty. They are not overwhelmed with the situation, but they are working to find a solution. So they will listen to others and even validate their point of view. While they are interacting, they'll maintain eye contact. to communicate that, yes, I'm listening, I'm understanding, I'm ready to work together. Especially their tone of voice, you will see it will be confident but friendly. They'll not be rude and harsh and intimidating in their tone of voice. So some of the examples that I can share with you about assertive communication is, they'll often say, I can see this is important to you, but this is important to me also. Let's talk and find out what can we do about it. So usually their approach will be, let's find a solution that suits you and that suits me also. Very often when they express their opinion, they'll be very clear in saying, I think, I feel, I believe, because they believe, they own their feelings or thoughts or beliefs. They don't say, they won't say, generally people don't, share their opinion. They'll say, I think this is what exactly. So that means they own their opinion, their feelings and their beliefs. They'll also, when they want explanation, then they say, I don't agree. When they want more understanding, they'll be more respectful in asking for people to explain further. I'll appreciate if you let me know how exactly you want this to happen. So they're more respectful and more cordial in their approach. When it comes to, refusing for something, again, they'll be very cordial. Like, I'm working on something very urgent. Is it okay if I help you after I'm done with this task at hand? And then say, I'm really sorry, I'm already working, I am already overworked. Don't ask me to do it, ask somebody else to do it. Or for example, if you want to refuse somebody for some help that person is asking, and they may say, I have stayed last, 3 times in this week. I've stayed late in the last 3 weeks. So can we take this tomorrow if it is not very urgent? Or can I ask somebody to do it in my place? So the approach is again to find solution. If you see this example, the approach is to find solution rather than, shunning away the responsibility. So if I put 2 important, cardinal virtues of communication, one is consideration for others and openness of communication. And if we have these 4 styles of communication, you will see people who use passive aggressive communication. They will mostly use low consideration for others and also low consideration. This is about for passive communicators, they will use high consideration for others because they value others' rights than them, but they will not be open to communication. Whereas passive aggressive people will have low consideration for others and low openness to communication. Aggressive people will be high on openness to communication, but will not be considerate for others. Whereas people who are assertive, they have high consideration for others and they have high openness of communication. I think these are very 2 important virtues of communication. When you communicate, you are considerate for others and for self also. At the same time, you communicate in a very honest and open manner. So people who assert, they create win-win situations. Whereas people who are passive, they lose for themselves, but for others, they create win situations. People who are passive aggressive, they actually create lose-lose situations where neither they win nor others win. People who use aggressive approach, they look for win at all cost, but they want others to lose in that bargain. Assertive communication creates win-win situations for both the parties, which is most desirable in all situations. Very quickly, just 5 more minutes, and then we move on to the presentation by our presenters who are ready. Practice session. That will give you an idea how to really change your communication and make it more assertive. So for example, when you are talking in a meeting, somebody might interrupt you often. How do you feel? When people interrupt you? Feel good or bad? And a lot of us start saying bad.
Of course, bad.
Bad. And then say, let me complete. Can you wait for a minute? Let me complete. Is there a way to say what you want to say, but in a more assertive manner? Can you come up with some examples? So in a firm and a respectful manner, you say, can you please allow me to complete? I think we can have this discussion after we after I finish my presentation. So, I mean, it's a more cordial way of saying what you want to say. Or sometimes people don't give instructions on time. Later on, we tell them, you didn't give me instructions, not my fault. Can you think of any other way to deal with that situation when people don't work on time or when they don't give instructions on time? Try to think. You know, assertion is one skill we are not taught, and it's not inborn. It's not innate. It's a learned skill. So it requires a little bit of working. But let me tell you, when you start using assertion, you feel so relaxed and comfortable and confident because you know you are not going to create conflict for yourself or for other person. But this is a skill that has to be learned. It comes with little practice, not little practice, with lot of practice. But once it is learned, then it becomes your way of communication. Then you don't have to worry that I'm going to upset anybody. So instead of saying later on that you didn't give instructions on time and that's why I'm not done it, I would rather say I'm really getting, give me 1 second, I'm not able to read because of this slide covering. Okay, so instead you say, I'm really getting delayed in making the plan of work since I don't have the clear instructions yet. Could you please give me the details at the earliest? So that means rather than complaining later on and saying that you didn't inform me, so I'm not here for the meeting. So a lot of those who are not here, they might say that you did not, inform me about the meeting, so I'm not here for this session. But rather proactively, you communicate that please give me the instructions on time so that I can complete my work. Also, when you go with your seniors or with your colleagues, so sometimes they dominate the discussion and they don't let you present your work. So how do you really communicate this to them that you feel bad that you are not allowed to, present your work because you want to take credit of what you've done? So can you think of any way to communicate this?
Sometimes when that we know that you are senior, but I would also like to present my work. I also to fix your work. I also would like to sincerely present at some
Dr.
point.
Atul, your voice is not clear, so honestly, I'm not able to exactly hear you. Yeah.
Can you hear me now?
Yes, definitely. Go ahead.
We can tell them that I know you are seniors and you are experienced in your work, and so you will like to present more things. But I have also been here for quite some time, and so I also know about these things, and I also would like to present something. So if you give me opportunity, I would like to also present sometime.
Wonderful, wonderful, excellent. I think that's the way you're communicating, that I respect your experience and your expertise, but given a chance, even I would like to showcase my skill. Excellent. I think that's a very good attempt that you made. Or something like this. I feel frustrated during meetings with you as I don't get to present my work. I would like to do a complete presentation so that I could provide my inputs. So you are firm, but respectful at the same time and expressing your honest feeling how you are doing. So there's so many ways that you can try. The last slide on practice session. So a lot of time I hear people saying, oh, this place is horrible. It's impossible. Nothing will improve here. This place is going into shambles. But does that help? That's just like, kind of cribbing over something and not having anything. So is there any good way of saying the same thing if you are really concerned? So when you communicate in this manner, I find it really difficult working here. I think something needs to be done about the way we handle important issues. I'm worried about the future of the organization. So you're very clearly, honestly expressing your concern about it. So there's so many other ways. This is just an example. You can think of many other ways, but we have to learn to communicate. We have to learn to assert. That's one thing we really need. That's why I spent full one session on this, because this one skill can change the way you handle your situations. The benefit of assertive communication will be there will be no accumulated anger. So when you will start asserting, there will not be passive aggressive communication because you were very honest in saying you will not carry any, anger or grudge within you. Others will take your opinion seriously because you don't talk nonsense. You don't talk ill about people. You don't talk behind their back. You're very honest and open and respectful in sharing your opinion. So they will respect your, opinion. You will earn respect and credibility at home and also in your workplace. Of course, the risk of exploitation and abuse will go down, especially for those who are passive communicators, because they are at a greater risk for exploitation. Relationships will become healthy at both workplace and at home. And life becomes easy and stress-free. So next time when you decide to communicate with people, remember that we have a style and the other person also has a style of communication. Notice yours and notice their communication style. And always remember, if you will use assertiveness, you can handle any kind of situation. You can manage it. Thank you. So this is in nutshell about assertive communication. Any questions about what we have discussed? Did you like the topic? Are you finding it useful?
Yes, ma'am. It's quite interesting.
You think that this will help us in improving our communication?
Yes, definitely.
And it's not just for the professional work, I'm saying, even in your personal life, with your family members, with your spouses, with your children, with your siblings, parents, when you assert, it makes your communication more clear and honest. And you feel so light by sharing whatever you think or feel in your own words. I think that's the beauty of this skill. It's difficult, but once you learn, it changes the way you lead your life.
I have a question actually.
Sure.
This presentation was really amazing. It was an eye opener. I looked through everything and I realized that actually there are strokes of brilliance when I personally would assert, but then there are regions where I would definitely want to improve. So, like, how would one go about it? That's my question. How would one become more assertive and not just drawn back?
So what happens, Dr. Sabyasachi, for example, you are in a situation and you have a desire to say something. You have an opinion. Maybe you don't agree with what others are saying. So what normally holds us back?
That I'll be judged.
I'll be judged. Okay. What else?
Perhaps I'm incorrect.
Perhaps I'm incorrect. Okay.
Like, as in,
Absolutely. What do others say? What is the usual fear when we hesitate expressing our opinion in an honest manner? It could be anything. It could be, I don't care. It could be, that's none of my business. Or it could be the fear that others might judge me, or they may label me as aggressive, or they may, get annoyed with my expression, and I will be creating conflict of interest, and then this person will not like me. They will not, they will not take me as their junior or as their co-worker or as their fellow professional. So these are the usual concerns. So the problem is, if we say the thing the way we normally say, it can create all these things, what you said. So what we need to do to learn how to assert in a situation when you wanted to say something, but you hesitated saying for any number of reasons, come home, sit with yourself and ask, how could have I said what I wanted to say in a different manner? You will start getting ideas. I could have said this, I could have said this, I could have brought this up, I could have mentioned this. You will start having this. So slowly, when you will go to the similar situation, you will have these ideas as a backup point, that this is the way to say. For example, if you're not agreeing with somebody, normally we have a tendency to say, especially when we are with our same age group fellow, I don't agree with you. I don't think this makes sense. But we also know that this is not the right way of saying. So you come home and ask yourself, if I don't agree, what are the other ways I can say the same thing? So you say, see, I respect your opinion, but somehow I feel I'm not in agreement with what you say. You're saying, can you explain me further? So what you're saying, I respect your opinion. That means you are not being disrespectful, but you're honestly saying, I'm somehow not agreeing with your point. And then you're also asking for more explanation. Now you have this at the back of mind. Okay, next time if something like this happens, rather than simply saying, oh, I don't agree with what you're saying, I will say these 3 sentences. So initially it takes time to bring this in your communication. Then slowly this will become the way of communication. There are 4 stages of learning: unconscious incompetence. We didn't know that assertion is the right way of communication. Conscious competence, we got to know, okay, I assert, but I don't assert enough. And there are many ways to learn it. Third is conscious competence, where you make efforts to mend your way of communication. So you mind your language, you mind your body language, you mind your tone of voice. Okay, I'll speak the same thing, but little slower, so that others can, get a chance to look at my demeanor and my body language and other things. And I'll not be aggressive. My tone of voice should be, softer, so that it doesn't come as aggressive person. The 4th stage of learning is unconscious competence, when this will become your way of handling situations. It's a little practice, but this skill is something like learning swimming or driving. Once you have learned it, this will become part of your schemata. Does that help?
Yes, madam, definitely.
It's always reflecting on the situation, post situation, that can prepare you for future situations. And rather than blaming the person, ask yourself, what can I do to change the outcome? Even with the person who is aggressive and dominating, you can assert without verbally communicating, but through your body language and whenever given a chance with few words. Thank you for asking that question. That was very good. Thank you. So we have 2 presentations, but we are just, I think, how many are we? Are 6 of us. So we have an option: either we present this week or we present next week when we have more people. What do you want, Dr. Varsha and Dr. Ashwini?
Ma'am, let us present this week.
Let us present this week. Okay.
Yes, ma'am.
Fine. Okay. So I think we have 2 presentations, one by Dr. Ashwini and then the other one is by Dr. Varsha. So I am giving you the rights to share your screen. Dr. Ashwini, I think you want to present first? Okay. So I have given you the right to share your screen and you can start with your presentation. Thank you.
My screen is visible to everyone?
Yeah, but I think you want to share this. Yeah, that's fine. Yes.
Yes. Is it visible now?
It's visible.
Okay. So hello everyone. So we are now in the mastering the pedagogies. So I chose the type with So, coming, what is quiz or a rapid fire question? So basically, it's an informal test or examination. So it can be conducted for a group of students, class, trainees, employees, or a conference audience as well. So, am I audible to everyone?
Yes, you're on.
Okay. So it can be, the beauty of the quiz is it can be taken at the start of your session, or in between the session, or at the end while concluding the session, if you want to give a message to the audience. One thing, and the other thing is you can include various questions, the different type of question, the multiple choice question, or the true or false kind of question, or factual based question, or you can give some practical scenarios if you are dealing with professionals, and then you can ask judge the rather judge, I will say, you can put the questions to the participants. So that is the other element, the beautiful part of the quiz. And it can be conducted in both the present audience, and we can conduct online, so with the remote audience. So what are the uses of the quiz? It can be it will make your lecture more interesting, so that you can engage the students in the classroom, or it can be used as a tool to train or educate the employee at work. Also, to break the monotony in the meetings, in the conference, to break the monotony, to make it more interesting, you can use it in the employee meetings, or in a big conference also. So it will act as a fun game or activity, and at the same time you can include your question, you can customize your question, and you can deliver a meaningful message to the bigger audience. And basically it will help to engage the remote participants also. So that is another use of it. So the advantages are, it is very good interactive learning. It helps to boost engagement, and also it ensures the participation, because in a bigger group, probably you can't just pick and ask question, or you can't make participate each individual. In that case, probably you can ensure the participation of all the audience. And also it can act as it is a good tool. It will act as to assess the course. If you are conducting a course, you can put the pre and post course quiz. So that will help us to evaluate the effectiveness of the course, and to make improvement in it. So that is one more advantage. And also, if you take quiz prior to your course, or take quiz prior to your lecture, that will help to understand your audience. So accordingly, you can plan your course, and you can plan your lecture. So you will know your audience. And also, it can cover, you can frame question like so that it can cover broad range of subject areas in a single test. So that is another advantage of it. And the major advantage is it brings the audience together. So that I feel is very important. So it brings the audience together. So disadvantages are, so it is a new technique to learn. Probably we need to go and acquire to know more about it. Go on the net, search more, or you need to study your subject thoroughly. You need to plan the questions. So it can be a little bit of brainstorming from on your side. One thing. So that can be an added task. So apart from making a routine lecture, this becomes an added task. And putting it is a little difficult, or it is not possible to put creative subjects or creative professions into the quizzes format. So it probably is not applicable in those areas. And and in quizzes, lot of guessing can happen. Even if the participant don't know the subject thoroughly, or there can be a lot of guessing also. So probably it can misguide sometime on the understanding of your audience. You feel that the audience has understood, but probably they have not thoroughly understood. There is lot of guessing has happened, and you are misunderstood about the what they have, whether you have completely delivered your message or not. And this was about the advantages and disadvantages. So what are the do's and don'ts when you are plan your quiz? The do's are include your you should, whenever you are planning your quiz, you first understand your audience. So to whom you are making the quiz, that is the important thing. So they level their education, their profession, or what they, also you need to take into consideration what topic we are dealing, what are the objectives if you are doing a course for a trainee or your employees. So that those things you need to take into consideration. So include questions that are in the line with your learning objectives. Don't divert from that. So that will divert their attention as well. The other thing is design, try and put more of a performance based or a practical scenario questions. So that makes it more interesting. So they will feel more interesting, that they will think and then they will answer. And also, as I said, customize your quizzes so that you will, to make it more interesting, take into consider what audience you are dealing with. Also, while making this was about the questions, while choosing the answers, to balance the placement of correct alternatives. Don't end up putting all the alternatives as correct alternative as A or B or C. So this they are, I mean, they will then guess that and they will end up marking the correct answers. So then coming to the don'ts, don't try and ask the questions which are not relevant to the content, which will divert the attention, and don't ask too many complex questions that can become little boring. They will lose interest. Also avoid repetition of the pattern of question, like lot many, none of the above, or all of the above. So with that, a lot of guessing can happen. So they will tend to guess more. Okay, and avoid too many incorrect answers. If you are putting too many incorrect answers, then you are actually giving them answer easily. So then again they lose interest. They need to, there should be something to, I mean, to think and then answer. So answer should not be given easily to them. So this was about don't. So so what should you follow and not while planning your quiz? And this was all about a little briefing about the quiz. So you can plan your quizzes on the quizzes.com. So that is very good tool. So I would like to share a quiz. I will put the link on the chat box. So you all can click the link, and I'll be putting very little basic, questions about glaucoma. Then you all can answer. Even ma'am, you also can join.
Sure.
I'm sharing.
Please unmute your device. Yeah, Dr. Ashwini.
So I'm just copying the link. Just I will need half a minute to do it, ma'am.
Sure, sure.
So has everyone joined the link? So can you see the screen now?
Yes.
Madam, it's a blank screen.
It says enter your name.
You have to enter your name there.
Okay, done.
Share. We have to share. Share. Can you see the screen now?
Yes.
Yeah. So I'm starting the quiz, and you all can participate in it. Okay. So you have 30 seconds for the right answer. So I think so it is done. I think all have participated and I have done. All have done. Even ma'am, you have done well. So this was just to give an idea about the quizzes. So this is very good. Can we act as a good ornament on our PT? So during while making presentations, as I said before, during and after the presentation.
That's a very nice app, very interesting app one can use. So you just went to quizzes.com and you developed this questionnaire?
Yes, I went to the quizzes.com. So then you will have to create your you have to log in from your Gmail ID and password. Then there you can make your own quizzes, and it is very easy. So you can format your own questions. You can type there. You can choose type of your questions, and you can save it, and it is just a very simple step-by-step process. And you can save your quiz for your future purpose, and you can use it at any time.
Madam, I have a question.
Yes.
So once you save it, like suppose you are delivering it to a group of people, like it seems to be like Kahoot. So do the results come to you so you can actually select who clicked first or something?
The result, this result come to you. So what I did is, so I shared my login ID page on the my accounts through share screen. I shared my account page on this thing, so you could see my account details. So whenever you are the participant is putting the answer, so you can see where the trend is going. How many are answering correctly, so you can see it on your account.
Thank you. Wonderful
Yes, ma'am.
experience. Thank you so much.
Yes.
Thank you. So can we request Dr. Varsha to present her topic?
Ma'am, am I audible?
Yes.
And is my screen visible?
Yes.
So nice presentation after by Dr. Ashwini. Now we are going to learn about how to make the PowerPoint presentation impressive. So can anyone comment on this slide? How is this slide? Can anyone comment, please?
I can't read.
Too much content.
Yeah, yes. So lots of text has been engaged in these slides with a very small font, and there are no images or no any graphical presentation. Similarly, in this slide, there is a background picture, but there is a very poor color contrast between the background picture and the text color. The same is the incidence with this slide. The color contrast is very poor with the background picture and text, and the graph, the content is like in a sentence form. No bullet points has been covered in this. Paragraph has been written as like that, so the audience can't understand what the presenter want to convey. Similarly, in this slide, the lots of graphs has been covered, like almost about 100 graphs has been covered, and no one can understand what it actually wants to deliver to the audience. So all these slides make your presentation very, very boring, and audience become disinterested in learning you. So what are the points to make your PowerPoint presentation dynamic? So always keep in mind that keep the text very concise and precise. Deliver your whatever you want to deliver, just deliver in a talk, but not write on a slide on a word-to-word basis. Try to incorporate a universal design template, and also keep the design template very consistent and simple. Regarding the font size, always choose a font size between the 24 to 30 point, and try to keep the slides, number of the slides very minimum. Like number of the words per slide should be also very minimum. Regarding the graphic and design makes your PowerPoint presentation very impactful. But try to use only one graphic or any, not incorporate too many graphics or too many graphics or design per slide. Regarding the color, you should have the color contrast between the background image and your text color. Always remember the rule of 10 by 20 by 30. Means if you have a slide about 10 in number, so your presentation should not be last for more than 20 minutes. And font size should be as per the 30 points. Okay. There is also one rule like 177, that is you should have only one idea per slide. There should not be more than 7 words per slide, and should not be more than 7 bullet points per slide. Now, to make your presentation very impressive, start with an icebreaker activity. So it keeps your audience engaged and they are familiar with each other. So they will not get bored with while listening to your speech. Okay, then address the objective very clearly in the introduction. So the audience will come to know what they are going to learn at the end of your presentation. Try to keep your presentation more interactive and encourage the group discussion. Tell everyone that you have all the power to participate in the learning as well as in the contribution by the group discussion. Then always identify your audience, identify their knowledge level so that you can impart more knowledge to their level. Okay, then your presentation part is very important while you are delivering any topic. So always make a eye contact, your facial expression, your hand gesture, make a very important point while you are presenting to the audience. Then don't read the slide word to word. Don't make it too lengthy. Stick to the time, adhere strictly to the time given to you. Then don't use the complex terminologies. If you're using it, just define it in your intro slide. Then don't use too much punctuation and animation marks. Also, don't use many acronyms in the slides. Advantages of PowerPoint presentation. It is a highly collaborative solution. Like PPT allows multiple people to access and edit and comment on a presentation at the same time on a same slide. We have the design flexibility, like we can incorporate any type of the template as per our presentation. You can virtually work from anywhere and you can save your PowerPoint presentation on a cloud platform. So you have the access to your PowerPoint presentation from any site, anytime. You can export your PowerPoint slide in different formats like JPG, PDF, PNG, and you can also export your videos. And it is accessible for all the users. Even the audiences who have the hearing or visual disabilities can have the access to your PPTs. Disadvantage, of course, it is highly potential for the technical problems. You have to learn all the software skill, or you have to be master in all the software skill to make your presentation very good. Then many of times the presenter have to rely too much on the slides. So instead of delivering the content in a precise manner, the presenters keep on reading the slides and it makes your presentation very boring. Then lack of expertise, as I have told you, make your presentation very dull. And as of now, many presentations are ready to available on the Google platform. It discourages the complex thinking and many innovative ideas. So considering this, the first slide would have make like this. So it covers the bullet point. It has only precise text and it has focused the point or the idea which have to be told in a footnote. So making the your PowerPoint presentation be precise and concise. Thank you.
Thank you, Dr. Varsha. It was a wonderful presentation. I think we got to know common errors we all make when we are making the presentation. Very precisely, you have covered all points. Any questions from the audience? Can you stop sharing, please, Dr. Varsha? Can you stop?
Yes, ma'am. Just a minute, ma'am.
No problem. Thank you. Any questions, Dr. Tehal, Dr. Sabyasachi?
Ma'am, my question is for Dr. Varsha. So how many time we have to spend on each slide?
Yeah, so Sneha, depending on your previous knowledge and depending whatever the contents you are going to deliver for the speaker, you have to spend at least 2 to 3 days and try to spend more time in delivering or preparing for the presentation rather than working on the slide, because too much content in the slide give you the less time to prepare yourself for the presentation. So it is an important part. Yes, you want to tell something?
My question is actually how much time you have to give for each slide while presenting?
Yeah. So it should be a 1 minute per slide.
1 minute. Okay.
Yeah.
Yes. Thank you.
So usually it is 1 minute, but in case if you are just showing some samples, it could be even less than a minute. For example, if you want to show the litter in the hospital, So maybe you will have multiple pictures, one after another, just to prove that, okay, there's a lot of litter around or there's a lot of junk around. So then maybe you will not be spending 1 minute, but then mostly 1 minute is enough to cover content also in the picture. I think that's what you'll be doing. Yeah.
Okay. Thank you. Thank you, ma'am.
Thank you. Any other question from? So thank you so much, both of you. I think you both made a wonderful effort and did a very good job on your presentation.
Thank
I'm
you.
sharing the feedback form. I request you to quickly give your feedback. Not on the presentation. We are not evaluating the presentation, but this is on the topic that I covered, handling uncooperative patients and handling difficult conversation. So we are not evaluating the presentation. They have done very well. I hope you are able to open the link. So for the next session, can I request Dr. Snehal and Dr. Sabyasachi to make the presentation? Pick your topics from the list and discuss with me before you present, and then be ready with the presentation next week.
Okay.
Thank you.
Okay, ma'am.
Thank you.
Regarding the next session, can you hear me?
Yes, we can hear you.
Yeah. 14th, the Friday, the holiday for us. So can we rearrange it to 12th or 13th, confirming NNN also?
I am okay. 13th suits me more, but in case if everybody's okay with 12th, I can consider 12th also. Although 13th suits me more.
Yeah. I think at HPTSI we will be comfortable with both the days. The NNN people need to confirm.
So Dr. Sabyasachi, can you check with Dr. Subrasil and confirm out of 2 days which suits them? I think they have the regular meeting on Thursday. I think this is what. Maybe we can put this in the group and let's see how they respond. We can say that the next session will be not on 14th, but on 12th or 13th. Or I'll put it 13th. Let's see what everybody says. But just give thumbs up if you're okay with 13th, so that we know how many people are okay with that.
Yeah. Okay.
Thank you so much for reminding us.
Yeah.
Thank you.
Thank you. So if you could give your responses.
Thank you, ma'am.
Ma'am, we have to select topic now. Previously, I have already selected.
For the same topic, whatever you have chosen, I'm okay with that. Topic is your choice. Only thing is, you be ready. Both of you be ready to, present in the next week on whatever date we decide, 13th or
Okay. And when shall I call you? Means what your preferable time to call?
Whenever you are ready to share the presentation with me on WhatsApp or on email, and then
Okay.
once I have a look at it, then we can talk. I am around 9.5 hours behind India time.
All right.
So
All
this
right.
time suits me. This time suits me. It's day here.
Hmm.
Anytime
Okay.
during the day. It will be evening for you, so it's good for you after you finish your hospital work. You can come and talk to me when you're at home.
Okay, ma'am. So nearly around 4 or something.
So 4 for you will be 6:30 early morning for me.
Okay. All right. So maybe after 6. Yeah. Better.
Yeah. After 6 will be fine. It will be 8:39 for me, which is
Yeah.
okay. Yeah.
All right. Okay, ma'am. Sure. Okay.
So I've received 4 replies, Dr. Ashwini, Dr. Snehal, Dr. Atul. Dr. Varsha, I think your response is still awaited. Is she there? No, she's not there. It's okay. I think I have sent the feedback form in the group. So those who have not completed, Dr. Sales have not completed, so I can ask them to complete. Thank you so much. I think we'll end the discussion here. Had a wonderful time with all of you.
Thank you.
I hope it added some learning to your skill set. Thank you once again. Thank you.